Hello, Thomas Malchow here. In this video, we're discussing lumbopelvic hip complex dysfunction, or as it's better known as, lower cross syndrome. And I'll show you how this dysfunction not only reduces your distance off the tee, but also contributes to swing faults, inconsistent ball striking, and low back pain. So lower cross syndrome is one of three main postural dysfunctions outlined in the scientific literature. Somebody who has lower cross syndrome will have an excessive lordotic curve and an anterior pelvic tilt, giving them a sway back. And sometimes this is very obvious, and sometimes it's not very obvious at all. This posture, and all postural dysfunctions, in fact, are due to muscle imbalances. So a muscle imbalance is a combination of short and overactive muscles with long and underactive muscles. And that compensatory pattern not only changes your posture, but also how you move. It creates movement inefficiencies, joint instability, pain, inflammation, and injury. And of course, all of that's going to decrease your performance. So how do we get lower cross syndrome? Well, basically from sitting too much. We spend a lot of our day sitting at home, at work, and in the car. And when we sit, we're in roughly 90 degrees of hip flexion. Now, in the front of our hip, there are 9 muscles that are collectively referred to as the hip flexor complex. And when you spend so much of your day at 90 degrees of hip flexion, the hip flexor complex becomes adaptively shortened. And when a muscle becomes short, it also becomes overactive. Now, if you have a short and overactive muscle on one side of a joint, you're automatically going to have a long and underactive muscle on the opposite side of that joint, and that's due to altered reciprocal inhibition. Now, the confusing thing is, for most people, that when they hear the term short and overactive, they assume that the muscle must be strong. They are not strong. Both long and underactive muscles and short and overactive muscles are weaker than muscles of optimal length and tonicity. However, short and overactive muscles are 1/3 stronger than their long and underactive counterparts, and this is where the imbalance is rooted. So we spend a great deal of our day sitting. We've got short and overactive hip flexors, which means we're going to have long and underactive hip extensors. The prime mover for hip extension is the gluteus maximus. And so if you have a short and overactive hip flexor complex, you're going to have a long and underactive gluteus maximus. This is obviously a big problem, not just for the golf swing, but for normal daily function. Our problems don't stop there. Your body just doesn't accept the situation. It adjusts and it asks the synergist to pick up the slack. Now, the synergists are muscles that are supposed to help the prime mover move a joint. They're not supposed to dominate, they're supposed to help. But when the gluteus maximus becomes inhibited, the synergists, which are the hamstring complex and the erector spinae is the muscle in your low back, they begin to pick up the slack, and eventually they become the dominant hip extensors. And when this happens, this is referred to as synergistic dominance. Synergistic dominance is a very bad thing. Basically, your body has come up with a compensatory pattern that's going to allow you to get through normal daily function, but in doing so, has increased the wear on your joints and connective tissue. So, the joints associated with lower cross syndrome negatively are your ankle, your knee, your hip, your SI joint, and your lumbar spine. And that joint instability and loss of neuromuscular control causes movement imbalances, and that can be illustrated by an excessive lordotic curve when you go into a squat, lunge, or when you swing a golf club. And in fact, lower cross syndrome is the #1 cause of low back pain in golfers. So now that we know all this, what do we do about it? Well, with any postural dysfunction, the first thing we have to do is identify the muscle imbalances. So we need to identify which muscles have become short and overactive and which muscles have become long and underactive. Now, just as a side note, there is a third category of muscles that do become long and overactive. There are not many of them, but it does happen. We're going to ignore that for now because it will complicate things quite a bit. And I know that this is a lot of information to take in, but we will get into this in a future post. Okay, so we need to come up with our 2 categories, short and overactive, long and underactive. Now, with lower cross syndrome, the muscles that have a propensity to become short and overactive include our soleus, our lateral gastroc, so 2 muscles in our calf, our anterior adductors, our hip flexor complex, of course, latissimus dorsi, and erector spinae. Okay. What about the long and underactive muscles? Well, the long and underactive muscles may include anterior tibialis, posterior tibialis, gluteus medius, gluteus maximus, transverse abdominis, and internal obliques. So now we have our two categories, right? Now, whenever we fix a postural dysfunction, there's an algorithm we follow. We first inhibit the short and overactive muscles, and we would use either a foam roller or a myofascial release ball or a softball to do that. The pressure applied to these short and overactive muscles by the foam roller is going to initiate a reflex inside that muscle, getting the muscle to relax, right? And so then we'll have the muscle in a relaxed state, which then brings us to step two. So step two in the algorithm is now we stretch the short and overactive muscles to return them to optimal length. Now, once we've completed those two steps, we turn our attention to the long and underactive muscles and we activate these guys. Now, for any muscle that requires activation, there are going to be overactive synergists that need to be inhibited. And so with the gluteus maximus, remember, the hamstrings and the erector spinae become the dominant hip extensors. And so if we just try to activate the gluteus maximus, we'll just be ramping up the hamstrings and the low back. And so when we do our activation technique, we're going to have to come up with ways to inhibit the hamstrings and the erector spinae, and I'll show you how to do that. So after the activation, we then move on to the fourth step, which is the final step, and this is integration. So we use integration exercises to increase neuromuscular control in all three planes, and this is how we actually increase the capacity of your body. Okay, so now what I'm going to show you here is a very simple routine. We're not going to dive into a full intervention. That would take far too long, but I'm going to show you a few things here that you can do that'll go a long way in improving your situation. So we're going to pick one release technique, one stretch, one activation technique, and then one integration exercise. Okay? I'm not going to do both sides. We'll go through this fairly quickly, but I'll show you how to do it. So I'm going to use a myofascial release ball for the release. You can use a foam roller or a softball, a baseball even, lacrosse ball. And the one release technique we're going to use is on our tensor fasciae lata, which is basically our front pocket here, okay? So the tensor fasciae lata is right here. I'm going to lay on the ground, put the ball right there, and let my body weight sink into that ball. And again, I'll just do the one side. So I'm getting to position here, find that front pocket, that tensor fasciae lata, and I survey around and I look for the most tender spot. And then once I find that spot, I just sit there and I hold this for 30 seconds. I don't move around. Moving around will just activate pain receptors. We want to keep this obviously as comfortable as possible. If it becomes too painful, you might start to tense up, and which could cause further dysfunction. Okay, so don't make it hurt too bad, although it might be quite painful. So after doing this for 30 seconds, I would then move on to a stretch, which would be a stretch for the hip flexor complex. And what I'll do is I'm going to use a yoga block here just for my knee. You don't need to. Is I'm going to get into position here. And from here, I'm going to tuck my pelvis under, okay? Now, we don't actually have very much hip extension, maybe 15 degrees. And so when you see people go right into here, all they're doing is they're just pulling on their lumbar spine. We don't want to do that. So stay up tall and just tuck your pelvis under, and just about 15 degrees of extension. You'll feel that stretch just in the front here. And we hold this for 30 seconds to 2 minutes. Okay? So now we've released and stretched our tensor fasciae lata, part of our hip flexor complex. We're going to move on to activation. Okay? Now the activation we're going to work on is for the gluteus maximus. This is the most important muscle we want to get activated with this whole routine. I'm going to use a fit loop, a 12-inch fit loop. I'm going to place this around my legs, above my knees. I'm going to lay on my stomach. Now, remember, we have the overactive synergist being the erector spinae in my low back and the hamstring complex to inhibit. If I just try to extend, my hamstrings and my erector spinae will do that work for me. We're not going to get activation of the gluteus maximus much. We're just going to reinforce the dysfunction. And so we need a way to inhibit. Let's start with the erector spinae. Well, we can inhibit the erector spinae by activating our transverse abdominis. And we do that by drawing our belly button in towards our spine. So we're not tensing up our abs, we're just drawing in the belly button. That will take neural drive away from the erector spinae and direct it towards the transverse abdominis. Okay, so I got belly button drawn in, got my erector spinae inhibited. Now the hamstrings, we can take neural drive away from the hamstrings by contracting the quads. Okay, so I'm going to straighten my knee right out and contract my quads to take neural drive away from my hamstrings. So I got my belly button drawn in, taking neural drive away from my erector spinae. I got my knee straight and my quads contracted, taking neural drive away from my hamstrings, and I'm just coming up 15 degrees of extension. Okay, and I hold this for 2 seconds and then down for 4, and then back up. And again, I'm not trying to get very high. Remember, we only have 15 degrees of extension. If I try to get higher, I'm just going to arch my low back. So belly button drawn in, quads contracted, 15 degrees of extension, up, hold for 2, down for 4. Okay, and I would do 12 to 15 reps of this on each side. Now, after completing that, I would finish off with integration exercises. An integration exercise, basically we want to get more neuromuscular control involved, and we want to start to get the subsystems to cooperate. So I'm going to use a TheraBand. I'm going to wrap it around this pole here. And I'm going to do a squat with a row. Now, a couple things to note here. I want the angle of my tibia and the angle of my torso to be parallel. I don't want to lean forward like this or like this. I want my torso and tibia to be parallel. I'm also not allowing my low back to arch as I squat down. That's going to be the tendency to want to fall into that anterior pelvic tilt. I'm slowly letting myself lower and then come up, squeeze. And the tempo again would be 4 seconds on the way down. We'd hold for 2 here. We'd come up for 1, hold for 2 at the top. So down for 4, hold for 2, up for 1, hold for 2. And again, 12 to 15 reps. Doing this will help you get out of this lower cross syndrome again. It will require a much greater intervention than this to get truly out of this dysfunction, but doing these 4 things will truly help your situation. I hope you enjoyed this video. Thank you for watching.